Thank you for joining us today as we prepare you for your upcoming spine surgery. Providence St. Joseph Health System performs thousands of spine surgeries a year and as a system has worked together to ensure excellent outcomes while delivering an exceptional experience. Our supportive team of experts are dedicated to helping you return to a life free from back and neck pain. We as Providence St. Joseph Health have created this class to not only help you and your family feel more prepared for surgery, but to also give you the information needed to promote a smooth recovery. Our agenda today will help step you through preparing preoperatively, the short time you'll spend with us at the hospital, all the way through your discharge to home. It is our hope that we'll be able to answer all of the questions you may have as we move through this presentation. But should you have questions that may not have been answered, please do not hesitate to reach out to your hospital's program manager or your surgeon's office. With Providence St. Joseph Health, the safety of our patients, our caregivers, and our communities is and will continue to be one of our top priorities. Providence St. Joseph Health has been a leader in the battle against COVID-19. We have created safety measures and processes to ensure the safety of our patients, staff, and visitors. Providence St. Joseph Health is working with and following local, state, and federal protocols in all of our hospitals and clinics. Now, prior to your surgery, you will be required to show evidence of a negative COVID-19 test. The timing of the test and receiving of the results is important, as the results of your test must be received by the pre-op department no later than 1 day before your surgery and no sooner than 3 days before your surgery. Once your COVID-19 test has been performed, we ask that you quarantine at home until your surgery. This will help limit any unnecessary exposures prior to your surgery. You will either be directed by your surgeon's office or contacted by Providence to schedule your test. It is helpful to have some understanding on spine surgery. First off, the spine is comprised of a number of vertebrae that stack one on top of the other. The spine is divided into a variety of sections. The neck region has 7 cervical vertebrae, the mid-back has 12 thoracic vertebrae, and the low back has 5 lumbar vertebrae, 5 fused sacral vertebrae, and the coccyx. The vertebrae protect the spinal cord, which delivers and receives messages from all around your body. Discs can be found between each of the vertebrae. Common surgeries are working to relieve pressure from the nerves or the spinal cord, stabilize levels where movement can lead to further symptoms, fix the structure of the vertebra, straighten the spine when the vertebrae aren't lining up correctly, or to help with medical-related issues such as tumors or fractures. Surgeries can be performed approaching through the front, the side, and or the back. For the appropriate candidates, they can even perform disc replacement. Your surgeon will go over your specific surgery and will help you understand what to expect. Our award-winning hospitals use advanced technology and state-of-the-art medical techniques to provide comprehensive surgical care for the whole person, body, mind, and spirit. It is very important to have the support of your family and friends as you prepare for your spine surgery. Having them attend this class, review any printed materials, or watching this video will help them gain an understanding of what you'll be experiencing and how they might be able to support you during this time before surgery all the way until you are home. Though you will be pretty functional by the time you go home, you may still require some assistance for tasks such as meal preparation, chores around the home, and getting to and from appointments. They will be the team that brings you home after your discharge and should be available to assist you once you are home. The following are a few helpful tips to keep in mind when preparing for your hospital stay. Here at Providence, we take pride in remaining good stewards of infection prevention. To help us in this, we ask that you wash your hands before all meals or snack times, as well as after using the restroom. There are hand sanitizing stations in each room that can be used as well to wash your hands. Each of our hospitals at Providence may have different visitation policies for your friends and loved ones to see you during your stay with us. Please contact the hospital for their most up-to-date visitation policy. We ask that you leave all valuables at home. This includes all jewelry and piercings. If there's a piece of jewelry that is unable to be removed, please advise your nurse in the preoperative area to secure it properly prior to surgery. Please keep in mind that all belongings that are brought to the hospital are your responsibility. Also, if you have sleep apnea and use a CPAP machine at home, please bring with you. Please let your nurse know so that the correct department can come to inspect it for safety prior to use. For a general idea of what to pack, here is a small list of important items we request you have with you when you come in for your surgery. Please have a current picture ID, an updated medical insurance card or cards. It is tremendously helpful to have the most up-to-date contact information for a family member or friend who we can contact. This phone number will be updated in your chart and may be used by the surgeon for updates regarding your surgery as well. Please let this person know that we'll be using their phone number as a main point of contact during your stay. If you expect there to be a hospital copayment or a copay for medications, please bring a form of payment with you in preparation. It is incredibly helpful to bring an updated list of medications, including prescriptions, over-the-counter medications, and vitamin or supplements you take at home. We request that you include the name of the drug and dose, as well as the time you normally like to take them, so we can closely mirror your home schedule as possible while you're staying with us. Do not bring any medications from home unless you're requested to do so. And if you have an advance directive, either a living will, post, or durable power of attorney, we request you bring a copy with you. This will be scanned and saved in your chart while you're with us. We will discuss advance directives a little more in depth further into our presentation. It is important to know which personal items will be necessary for your stay in the hospital. First, it is necessary to bring and wear clothes that are going to be easy to get on and off. Therapy will help teach you skills to make getting dressed easier. Wearing a t-shirt or tank top underneath your back brace, if one is ordered, will increase your comfort. Recommendations for clothing to bring include button-down or zip front top and elastic waist bottoms. If it is your preference, you may bring shoes and socks for walking. If you choose to bring shoes, Providence asks that they have toes covered and the heels covered as well to help protect you as you walk in the halls. Though shoes are not required, all patients will receive socks that have non-slip bottoms to be able to walk safely outside your room. Please be sure to bring personal items that you would use every day, such as glasses, dentures, and hearing aids. If you wear contact lenses, please be sure to bring an extra pair with you just in case. If you bring personal items with you, please let your nurse know so they can record this in the electronic medical record. You are allowed to have your cell phone and other electronic devices with you while you're in the hospital. It is recommended that you bring the needed chargers with you as well. It may be a good idea to bring those extra length chargers, such as those with a 6-foot or longer cable to allow you to have the phone near you while charging. Unless it's necessary for you to enter the hospital safely, we also request that you leave your assistive devices at home. This includes walkers, canes, or crutches. This will help eliminate any chance of items becoming lost or misplaced during your stay with us. In preparation for surgery, it is incredibly important to discuss an advanced healthcare directive with your primary care physician or surgeon. An advanced healthcare directive is a legal document in which you would specify what action should be taken for your health if you become no longer able to make decisions for yourself due to illness or incapacity. This document specifies what your medical wishes are, as well as who you designate to make the medical decisions on your behalf. If you would like, you may fill out a physician order for life-sustaining treatment form, otherwise known as a POLST, at home with your family and have your physician sign it. This form can be changed by yourself at any time, before or after your surgery, if your wishes change. This form will stay in your possession and will become part of your electronic medical record for future reference. For more information, please contact your hospital's admitting department. There is a little bit of work necessary to get you ready and completely prepared for your surgery. First, if you are a smoker or use any products that contain nicotine, including vapor products, it is important to stop use as far ahead of surgery as possible. Preferably, please stop smoking at least 14 days ahead of surgery to help promote safe healing. Also, it is important to limit alcohol intake for the same reason. If you're using any prescription pain medication or cannabis products, please have a conversation with your primary medical physician and your surgeon about stopping use of these products before surgery. Optimizing your physical health will help aid your recovery process and ease the transition from post-operative therapy to returning back to independent living. To help improve your physical fitness, stay as active as you can prior to surgery and perform daily exercises advised by your physician. Follow any orders and complete any additional tests that might be needed before surgery, and try to eat a well-balanced diet. While preparing for surgery, there are a few additional items that may be helpful in getting ready for your return home. Being safe after surgery is of utmost importance, especially when you get home. Before your surgery, remove common hazards around the house that may cause you to trip, like electrical cords, throw rugs, or debris. Make sure you have a clear path to get from room to room before you arrive for your surgery. Please be aware that pets and children can potentially cause you to trip and fall. It is very important to be aware of your surroundings. It may be helpful to refill any medications ahead of time to save yourself or your healing coach an extra trip to the pharmacy. Relieving yourself of any extra stressors during your post-operative recovery will help you focus on a smooth, safe, and quick recovery at home following your surgery. In addition, it may be helpful to have some meals prepared ahead of time and kept in your refrigerator or freezer. Infection prevention is key to preparing for surgery. An effective way to prepare your body for surgery is showering. You might be asked to use a disinfecting soap, such as CHG or Hibiclens, prior to your surgery. Please follow your surgeon's recommendations. And if you don't receive any specific showering instructions, be sure to shower the night before and the morning of your surgery. Your surgeon and general physician will work with you in deciding what medications you will need to stop prior to your surgery. Some medications can put you at risk for bleeding during and after surgery. If you are unsure whether you should stop a medication, please contact your surgeon's or your prescribing physician's office. Your surgeon will want you to be in good health when you undergo surgery to help with optimizing your outcomes. Please alert your surgeon should you have any of the symptoms noted in this slide as your surgery date approaches. When you call the surgeon's office to report any of these symptoms, please be prepared to answer a few questions, such as, when did the symptoms start? How high was your fever? Or have you received any treatment for this? You may be asked to attend a preoperative registration or admitting appointment. For this appointment, make sure you bring your picture ID, medical insurance card or cards, a list of medications prescribed, over-the-counter, vitamins, or supplements, including dosages you are currently taking, and bring your advance directive. You should also have the name and contact number of your ride home, as you will not be allowed to take public transportation home, such as taxis, Uber, or a bus. If you have any issue with receiving blood or blood products, please discuss this with your surgeon prior to this appointment. We are here for you. We, as Providence St. Joseph Health, believe it really is all about the communication, including things we offer like preoperative spine surgery education classes, surveys that we use for patient-reported outcomes, and our new digital platform, Twistle. Pre-op classes like this one, or in the in-person virtual class, gives everyone the opportunity to be better prepared for their surgery. Our research has shown patients who are better prepared have a smoother recovery. Not to mention, if you are able to make it to the class, you would have the option to meet one of the staff members who will be following you while you are with us, a valuable resource during your journey. Our patient-reported outcomes involve surveys. You will be asked to complete an assessment before surgery and during your recovery. This information helps us plan for your care as well as track your progress during your recovery. And lastly, we are excited about offering Twistle at a number of our hospitals. Twistle is a messaging program that helps us to keep you on track during your surgical experience. Your responses to these messages are important. Your surgeon's office will be made aware of any response that might benefit from at least a phone call. A Providence team member or your surgeon's office will let you know where you'll check in the day of surgery and at what time you should arrive. Be sure to follow any instructions given to you for any routine medications you should take, as well as any instructions as to what you may eat or drink prior to surgery. Again, we ask that you remove your jewelry and piercings prior to arriving to the hospital. After checking in on the day of your surgery, you'll be taken to your hospital's preoperative area. Depending on your hospital's visitor policy, a family member or friend might be able to accompany you. Your preoperative nurse will check your vital signs, have you change into a hospital gown, place belongings into a garment bag, and start an IV. Your surgeon might also prescribe some medications to be taken prior to your surgery. Prior to your surgery, you'll meet your anesthesiologist. You should talk to the anesthesiologist about any unpleasant side effects you may have had with surgeries in the past. You will also work with your surgical team in marking the correct area you'll be having surgery. You will then be taken to the OR. This is where your surgery will be performed. Your surgical team will perform your timeout. A timeout is a pre-procedure verification process for patient safety, ensuring the correct procedure for the correct patient to the correct site every time. Once completed, your surgical team will help position and prep you for your surgery. After surgery, you'll be taken to the recovery room, also known as the PACU. As you continue to wake up, the nursing staff will monitor you closely until you are ready to be either discharged home or transferred to a patient room where you can continue with your recovery. A member of your care team will contact your family to let them know how everything went. If you'll be staying the night after your surgery, you'll be sent up to the inpatient unit. This is where you will spend the rest of your hospital stay until you're discharged to go home. Please check with your nurse regarding your hospital's policy should a family member or friend decide to visit or stay the night. During your hospital stay, your surgeon or their assistant will see you each day. You will also have a team of staff members that will work with you under the direction of your medical team, which can include your surgeon and possibly a hospitalist or attending physician. For your safety, you will have a call light. Use your call light to get out of bed or to get to the attention of the nurse and/or nursing assistant to come in and assist you with your needs. Our nursing staff will come to your room frequently during the day, see how you're doing, provide medications, take your vitals, ensure your safety, and address any of your other needs. If therapy is prescribed, they will work with you in order to prepare you functionally for your return home. We're dedicated to creating the best experience possible for our patients. You will have a communication board in the room to help with orienting you with the day and the date. It will commonly have the names of the staff members caring for you, including your surgeon and your hospitalist. This may include special instructions for incoming staff. It isn't uncommon to experience some nausea after surgery. Your diet will be advanced slowly with the help of your nurse to make sure you can tolerate food after anesthesia. We put you through a testing process, starting with some ice chips and progressing to liquids and then to solids. Your nursing team can help guide you on how to order your food and make specific choices prior to each meal. Any special diets will be ordered under the direction of your medical team. Please let your nurse know if you have any special dietary requests or allergies. There are a variety of tubes and lines you might have in place after spine surgery. Variability depends on the type of surgery you're having and the preferences of the surgeon and anesthesiologist. Your medical team will help determine when these can be removed. It is our goal to manage your pain effectively. We want your pain levels tolerable enough to rest and tolerable enough to be able to participate with therapy. Our staff members will frequently ask you to rate your pain. 0 is no pain, and 10 is the worst pain you could ever imagine. We don't believe that pain-free is a reasonable goal immediately following a surgical procedure. We anticipate that there will be some discomfort. The level of pain that you tell us that you are experiencing will help your care team deliver the correct medications at the right time, including before your therapy, to help keep your pain tolerable and allow you to participate fully in your recovery. Through the years, we've recognized that opiates, though they can help with pain, have a number of common side effects, such as nausea and dizziness, causing low blood pressure, drowsiness, constipation, respiratory depression, and can cause dependency and addiction. To keep your pain under control, we have instituted a multimodal approach. This means that we will use a variety of approaches to help you manage your pain. Your medical team will determine which options would be safe and appropriate for your pain management. Well-controlled pain will allow you to participate fully in your recovery. Approaches to your pain management could include acetaminophen or Tylenol, nerve pain medications, ice packs or cooling units, meditation and/or distraction techniques, pacing your return to activity, and if necessary, narcotic medication can be added should these options not work adequately in controlling your pain. We are wholly committed to your care and safety, and there is a very good chance that you will not need all the medication that you are prescribed. It is not safe to have medications, including pain medications, sitting around the house where there is a chance that they could be mistakenly taken. But there are options. Check to see if your hospital can dispose of unused medications for you. Check in with your pharmacy to see if they're able to dispose unused medications. Go to the website noted on this slide to see if there are drug disposal sites near you. Lastly, it is okay to put unused medications in the trash, but be sure to mix them with something unappealing such as dirt, kitty litter, or used coffee grounds and place in a sealed container before throwing them away with your household trash. Also, remember to scratch out all information on the prescription bottle before throwing it out. Anesthesia, pain medication, and inactivity can all decrease your ability to take full, deep breaths, which can lead to complications down the line. These complications can easily be avoided with certain interventions. Take deep breaths. Take a deep breath, hold it for a few seconds, and then exhale. Do this about 10 times every waking hour. And many times, this will make you cough, which helps you bring up any lung secretions you might have. Your care team will bring you a respiratory device called an incentive spirometer, or IS. Follow their instructions and utilize your IS 10 times every waking hour. If permitted by your surgeon, try keeping your head of the bed elevated at 30 degrees. And remember, getting up out of bed and sitting up are great activities to keep your lungs healthy. Remember, only get up when assisted by a staff member. These recommendations should continue after you leave the hospital and long after into your recovery. Though nobody ever wants to talk about it, constipation can be a real problem after spine surgery. Most of our patients become constipated after surgery due to the narcotics, anesthesia, decreased mobility, and not having eaten for almost a day. And it can take a few days to get back on your normal bowel routine. But here are some ways to try to avoid this. Getting up and moving is extremely important if it's allowed. Drinking plenty of fluids and increasing the amount of fiber in your diet, such as eating fruits, vegetables, and grains, will also help a lot. At the hospital, your nurse will offer you a stool softener twice a day, every day, and a laxative or suppository. Once home, you should still be aware of this, as this problem, which frequently persists until you are fully off narcotics and back to your regular mobility. Over-the-counter or over-the-counter medications help to minimize the complications and discomfort of constipation. Due to the nature of surgery and inactivity afterwards, there is a risk of developing a blood clot after spine surgery. This can be successfully avoided, however, with the following activities. You can do ankle pumps by pretending to push on a gas pedal 10 times an hour. The nurses will place leg squeezers or sequential compression device sleeves on your legs, which automatically and rhythmically push blood from your legs to your heart. But early mobility and getting out of bed is still the best way to minimize the risk of clots. However, we should go over some of the common signs and symptoms if you should develop a clot. These can include shortness of breath, chest pain or discomfort that worsens when you take a deep breath, unexplained coughing or coughing up blood, swelling or pain in one or both legs, oftentimes in the calf, with a cramping-like sensation. Now, should you be experiencing any of these, it is important to seek medical attention immediately. Call 911. We carefully coordinate a personalized treatment and rehabilitation program that matches your unique needs. Therapy is a very important member of your medical team. Therapy is responsible for your functional recovery, allowing for your safe return home. Physical therapy will assist you with your ability to be mobile. Occasionally, based on the surgery you have, occupational therapy might also be called in to help with activities of daily living and self-hygiene. As a very important member of your medical team, therapy will be responsible for your functional recovery, allowing your safe return to home. Physical therapy and nursing will assist you with your ability to be mobile and will begin as soon as you are able to participate. Oftentimes, this will be the day of surgery. Occasionally, based on the surgery you have, occupational therapy might also be called in to help with activities of daily living and self-hygiene. Should your surgeon order a brace or a collar, therapy and nursing will ensure that you can safely put it on and take it off prior to your going home. Your therapy team will help in deciding if you will need any specific equipment and if continued therapy will be needed once you've returned home. For your safety, never get up without a member of our staff's assistance. Please use your call button should you want to get up. Depending on the surgery you receive, you will most likely have restrictions to your activities. Your treatment team will discuss any restrictions you will need to follow when you go home. These commonly can include no bending, lifting, or twisting. Now, prolonged sitting can put undue stress on your spine, so we encourage you to get up and move every few hours. Case management will work with you should you require any equipment for your return home. In the event that equipment you require is not covered by your insurance, case management will offer resources on how to obtain them. Some examples might be through Goodwill or from your local senior center. Your care team will educate you on how to care for your incision site, including cleaning and dressing changes if needed. You will be instructed as to when you can shower, and although we want you to be active, it is important to rest frequently through the day to avoid overdoing it. Remember, slow and steady wins this race. It is always our goal for our patients to be able to return home once they leave the hospital. It has been shown that home is the healthiest environment for you to recover. This said, work with your family and friends to ensure you have some assistance once you're home. If you are concerned about not having enough support at home, please discuss your concerns with your care team. It is important to plan ahead for the day of discharge. Since discharges can occur throughout the day, please have your ride available when called. Also, your team will finalize and review all your discharge instructions to ensure your safe transition home. Be sure to follow all of the instruction you received prior to leaving the hospital. Continue any exercises you were shown and be sure to get up and walk often. Depending on the surgery you receive, you might be prescribed to continue with therapy. Outpatient therapy reinforces the skills you learned for car transfers, walking, and also helps increase your activity levels and abilities. With your discharge instructions, you might receive a sheet like this slide. This should be used as a resource guide to help you in identifying any issues that require at least a phone call with your surgeon's office. Anything in the red zone, however, is a true emergency and requires calling 911. Above are a few common questions patients ask. Please take a moment to review. Should you have any questions not addressed during this presentation, again, please do not hesitate to contact your hospital's program manager. Their contact information will be located on the next slide. But should your hospital not have a designated program manager and you have questions that you would like to have answered, we suggest contacting your surgeon's office. Here are the program managers who will be available to you throughout your surgical experience. Please take a note as to who your program manager will be and their phone number. And remember, if there isn't a program manager noted for your specific hospital, please contact your surgeon's office should you have any questions. Now I'll leave this slide up so you can write down your program manager and their phone number. Thank you for your time to view this presentation. Providence St. Joseph Health hopes that this information has answered any questions you may have had. Again, please do not hesitate to contact your hospital's program manager should you have any further questions. And remember, if your hospital does not have a program manager, please direct all questions to your surgeon. Thank you for choosing Providence St. Joseph Health. You've got this, and we look forward to caring for you.